welcome to this special Scientific Digest episode for EULAR TV here at the EULAR 2022 Congress in Copenhagen. My name is Mrinalini Day and I'm an academic rheumatology trainee based in Liverpool in the UK. Today I'm delighted to have with me Professor Pedro Machado from University College London, whom is going to be discussing with me the work of the Global Rheumatology Alliance and the work with COVID and COVID vaccination, and specifically focusing today on spondyloarthritis and psoriasis, based on one of the abstracts being presented here at the Congress. So firstly, Professor Machado, thank you very much for joining me.
My pleasure.
Thank you. Maybe could you tell us a little bit briefly about yourself, and then maybe focusing firstly more broadly on the work of the Global Rheumatology Alliance over the past couple of years?
Yeah, sure. So I'm a rheumatologist based in London, University College London, and at the beginning of the pandemic, I developed an interest in COVID-19 and the impact on patients with rheumatic diseases. And when the pandemic started, there was a huge concern about patients with rheumatic diseases and the risk of COVID in these patients, mainly for three reasons. One, because they often have an underlying immune dysfunction, because they've been treated with drugs that affect the immune system, affect the competence of the immune system, the so-called immunosuppressive drugs or immune modulating drugs. And third, because many of the conditions that we treat, they affect multiple organs and systems, so the heart, the lungs, the joints, the muscles, and therefore this could put patients at more risk of severe COVID-19. So there was this urgent need to collect data about the outcome of SARS-CoV-2 infection in patients with rheumatic diseases, and that's where the GRA came along, because they rapidly developed electronic data collection system to collect data from patients with rheumatic diseases that had developed COVID. And EULAR partnered with the GRA, so EULAR started collecting data from EULAR affiliated countries, and the GRA started collecting data from the rest of the world. At the moment, we have more than 20,000 patients registered in the database.
Very impressive.
It is, and a huge thank you to the entire rheumatology community that has contributed in a fantastic way to this global effort. And at this EULAR, we're going to present data from patients with spondyloarthritis, but we've done something else. We've joined efforts with the psoriasis registry, so the PSO-Protect registry, which collects a similar type of data from patients with psoriasis. So we're going to present data from patients with axial spondyloarthritis, psoriatic arthritis, and skin psoriasis. And we looked at the outcome of SARS-CoV-2 infection in these patients, and we studied the factors that were associated with more severe COVID-19, so hospitalization and death, for example. And what we found was that many of the factors that are associated with a worse outcome are actually the same that have been described in the general population, but also in people with other rheumatic diseases. So demographic factors like age and male sex. Because we're now 2 years, well, actually more than 2 years after the start of the pandemic, and we've learned a lot about the way we should treat COVID as well. So we took that into account, and we also show that patients that have acquired the infection more recently have a better outcome, and that's just a reflection of the better ways that we have now to treat COVID-19. And importantly, in terms of the drugs that we use to treat these patients, namely drugs that have not been sufficiently studied in the past, so like drugs like interleukin-17 blockers, interleukin-12, 23 blockers, we were able to look at these drugs, and we were able to show that they seem quite safe in the context of COVID-19 because exposure to these drugs was not associated with a worse outcome. In terms of the comorbidities, like in the general population and in other patients with rheumatic diseases, we were able to show that they are associated with a worse outcome, and this applies to cardiovascular disease, chronic lung disease, chronic kidney disease, diabetes, obesity, cancer, so the usual suspects.
Great, fine. And I know that previous work from the GRA and the EULAR Registry, which was published, I think now going on almost 2 years ago now, showed like some disease-related factors were associated with COVID-19 outcomes. Did you see anything similar in either the spondyloarthritis patients or the psoriasis patients, or was it a purely drug-focused study?
We did, and that's a very important aspect of this analysis, and also a very important finding from our initial analysis. So what we saw is that higher disease activity is also associated with a worse outcome. Yeah. And I think this really emphasizes the need to monitor our patients carefully, which is extremely important in the context of the pandemic, when a lot of patients had their appointments cancelled. Yeah. We were using remote monitoring a lot, exactly. But I think it really emphasizes the importance of monitoring our patients, changing their treatments if needed, making sure that the disease is well controlled, because controlling their underlying rheumatic disease will also contribute to better outcomes if they acquire COVID-19.
Yeah, absolutely. I think there's a lot to learn there in terms of applications for clinical practice for those who are watching. And just one maybe final point, a sort of spin-off or a further work from the Global Rheumatology Alliance was the COVAX registry. Do we know anything about vaccination outcomes and implications in this particular cohort of patients?
So COVAX was a registry that was started when the vaccination programs were implemented, and we published a first paper a few months ago where we essentially showed that vaccination against SARS-CoV-2 is safe and very well tolerated by patients with rheumatic diseases, with a small percentage of flares that would actually be compatible with the natural history of this condition. So it's not even, it doesn't show causality, because these flares could just occur due to chance, and very few breakthrough infections in that cohort of patients. So this was a cohort of around 5,000 patients that we published already, several months ago. Yeah. We've now accumulated more data. Yeah. We are analyzing specific groups of patients, including patients with spondyloarthritis, but also patients with rheumatoid arthritis and connective tissue disorders. But that data has not been fully analyzed, so it will be presented soon, hopefully, but it's not been analyzed completely.
Watch this space.
Watch this space.
Fine, right. Well, thank you very much for joining me today. If you would like to know more, there is a special COVID abstract session going on the Friday of the Congress here at EULAR 2022, so do be sure to check that out either in person or on demand later on. Thank you very much for joining me, Professor Machado, and we look forward to seeing you soon again on EULAR TV. Thank you for watching.